Most people over 60 live daily with a silent lie that steals their vitality and, even worse, their hope. You've probably woken up feeling like your legs weighed a ton, or noticed your memory failing you in simple moments, like forgetting where you put your keys or the name of an acquaintance, and immediately thought, "This is normal. I'm just getting old." This thought is the greatest danger to your health today, as it masks the true cause of the problem. What your doctor may not have emphasized with the necessary clarity is that this overwhelming fatigue and these pains that limit your movements may not be a sentence of nature, but rather the biological price of a medication you religiously take every night to protect your heart. There's a very fine line between natural aging and silent drug intoxication, and crossing that line unknowingly can cost you your physical and mental autonomy. This video is not just a warning, it's a survival guide for anyone who wants to protect their heart without destroying the rest of their body. The scientific truth, often hidden in the fine print of drug information leaflets or in complex studies that don't reach you, is that statins, the famous cholesterol-lowering drugs, do save lives, but they exact a very high metabolic toll if your body isn't prepared. My big promise to you today is to give you back control of your health. We're going to dissect exactly what is a symptom of aging and what is a red alert signal from your body against statins. By the end of this content, you will have in your hands the 10 critical signs that the medication may be causing silent damage, allowing you to speak with your doctor with authority to adjust your treatment, protect your muscles, safeguard your memory, and avoid developing drug-induced diabetes. Before we delve deep into this science and reveal the list that can change your quality of life, I need you to do a quick and honest reflection right now in the comments. I want to know who is watching so I can better direct the following instructions. Do you use any statins, such as simvastatin, atorvastatin, or rosuvastatin? And, most importantly, do you experience muscle pain or excessive fatigue that you didn't feel before starting treatment? Answer with a yes, and briefly describe what you feel. This exchange is fundamental because what I will explain next will illuminate exactly the physiological reason why so many of you will answer yes to this question, revealing the mechanism that is shutting down the power plants of your cells while you sleep. To understand the root of this silent suffering, we need to look at the numbers that define global public health today. It is estimated that hundreds of millions of people around the globe depend on statins to keep their cholesterol under control, making it one of the most prescribed classes of drugs in the history of modern medicine. However, this popularity hides a worrying scenario of gradual intoxication and depletion of essential nutrients that is rarely discussed in the doctor's office during a routine consultation. The central problem we face here is not the ineffectiveness of the drug, it works very well for what it was designed for, but rather the fact that the treatment focuses exclusively on a numerical marker in your blood test, ignoring the biochemical complexity of your entire body. For the elderly, this is devastating, as it directly affects autonomy, muscle pain limits movement, mental fog, generates a terrible fear of dementia, and chronic fatigue prevents social activities, creating a vicious cycle of sedentary lifestyle and isolation that, ironically, worsens the cardiovascular health that the drug should protect. The scientific explanation for this is fascinating and at the same time alarming, but I'll explain it in a way you'll never forget. Statins work by inhibiting an enzyme in your liver called HMG-CoA reductase. Think of this enzyme as a factory manager that authorizes cholesterol production. By blocking this manager, cholesterol production drops, which is the goal of treatment. However, this same manager is also responsible for the production of a vital molecule called coenzyme Q10, or CoQ10. Here's the big miscalculation. By cutting off the cholesterol pathway, the statin also drastically blocks CoQ10 production. Imagine that the statin is a cleaning crew that sweeps fats from your arteries, but in the process ends up puncturing your car's tires. The road is clean, but the vehicle, which is your body, can no longer run efficiently. Without this substance, your body enters a state of severe energy deficit. This deficiency occurs because CoQ10 is the fundamental fuel for mitochondria, which are the power plants within each of your cells. The heart and skeletal muscles are the tissues that consume the most energy in the human body and therefore are the most hungry for CoQ10. When levels of this nutrient plummet due to the chemical blockade of statins, these power plants begin to fail. This is why you feel that inexplicable fatigue and those muscle aches that don't go away with rest. Physiologically, your cells are trying to run a marathon without having eaten anything for days. Furthermore, this metabolic alteration affects insulin sensitivity. The body, panicked by the lack of cellular energy, begins to have difficulty processing glucose correctly, creating an environment conducive to increased blood sugar, a side effect that catches many patients by surprise. We're not talking about isolated cases or theoretical assumptions, but about data validated by robust observational studies. Recent research indicates a worrying correlation between the continuous use of statins and an increased risk of developing type 2 diabetes, especially in elderly women, a finding that should change how we monitor these patients. Other surveys show that a significant percentage of users abandon treatment on their own due to myopathy, intense muscle pain, leaving themselves unprotected against heart attacks because they couldn't tolerate the daily side effects. The reduction in blood CoQ10 levels is a measurable biological fact after starting treatment. Understanding this removes the blame from your shoulders. You're not just getting old and losing vitality, you're chemically depleted, and the good news is that by identifying the signs I'll show you below, this situation can be managed. Now that we've mapped out what's happening inside your cells, we need to bring that into the reality of your mirror and your daily routine, transforming scientific theory into practical vigilance. It's very easy to get lost in medical terms and complex lab tests, but your body has its own, much more immediate language to warn you that something is wrong, and we're going to decode that language together now. I've prepared a meticulous list of the 10 most critical signs that statins may be negatively affecting your metabolism. It's not a random list. It's been progressively organized, starting with the most subtle and common symptoms, those you swear are just things that come with age, and moving on to the red alert signs that require an immediate trip to the emergency room. The goal here isn't to make you throw the medication away, but rather to arm you with the knowledge necessary so that you never again ignore a cry for help from your own body. Pay close attention to each item as the severity increases. As we go down the list, and what seems harmless at first can be the seed of a serious complication in the future. Sign number 1 is the most classic and the one that most often leads to treatment abandonment, but it is often misinterpreted as poor posture or common physical fatigue. Number 4 is one of the most dangerous and ignored, as it silently alters your blood tests, potentially leading to a diabetes diagnosis that could have been avoided if detected in time. And I guarantee you, sign number 3 touches on the deepest fear of those over 60, and understanding its real cause will take a huge weight off your shoulders. Keep your eyes open and your mind alert, because identifying just one of these signs today can mean the difference between aging with severe limitations and longevity with full autonomy and vigor. The first sign on our list is undoubtedly the most common and, tragically, the most ignored: myopathy, which manifests as persistent muscle pain and unexplained weakness. Imagine that your muscles are new and flexible. Under the adverse effect of statins, they can begin to behave like old, dry elastic bands about to snap. The sensation is not that of acute injury pain, but rather a constant heaviness, as if you were carrying sandbags in your arms and legs, or as if you had run a marathon without leaving the sofa. The elderly often look at this and think, "I slept badly," or "it's old age catching up." But the physiological reality is that the lack of coenzyme Q10, depleted by the medication, is preventing the muscle from repairing and functioning, generating constant inflammatory microlesions. Practical instruction is vital here. If you feel that climbing a flight of stairs or raising your arms to comb your hair has become a Herculean effort after starting the medication, this is not normal. Don't accept living with pain as if it were a tribute to aging. Talk to your doctor specifically about the possibility of adjusting the dosage or introducing CoQ10 supplementation to replace what has been lost. Protecting your arteries shouldn't cost you the health of your muscles, because without strong muscles, you lose independence. And if this muscle weakness seems bad, it directly feeds the second symptom, which is even more debilitating for your daily routine. Number 2 is extreme fatigue and lack of energy. A fatigue that doesn't improve even after a good night's sleep. Unlike laziness or the common tiredness of a busy day, this exhaustion is cellular. It's like trying to start a car with a dead battery. The mitochondria, which I mentioned earlier as the power plants of the cells, simply don't have enough fuel to generate the electricity your body needs to function. You plan to do things, go to the market, play with the grandchildren, go for a walk, but your body doesn't obey. This creates a dangerous cycle. Because you're tired, you stop exercising. When you stop exercising, your cardiovascular health worsens, the exact opposite of what the medication proposes. If you identify with this daily struggle to find energy, I want to extend a special invitation now. Our channel is dedicated to bringing scientific truths that return power to your hands. If you want to continue receiving guidance that protects your longevity naturally and intelligently, like this video, and make sure you're subscribed. This helps our message reach more people who, like you, need to know they're not alone. Returning to our bodies, this lack of physical energy is often accompanied by a symptom that terrifies anyone over 50, which we'll discuss in the next point. The third sign is brain fog and frequent forgetfulness. Suddenly, you enter a room and don't know what you were doing there, or the right word escapes your mouth mid-sentence. The immediate fear is Alzheimer's, and this dread paralyzes many elderly people. But calm down. The human brain is composed mostly of fat and cholesterol, which are essential for the formation of synapses, the communication between neurons. When we drastically reduce available cholesterol with a potent statin, we may be unintentionally starving the brain, hindering quick thinking and the consolidation of recent memory. The good news is that, in many cases, this mental confusion is reversible. If you've noticed your memory becoming gap, coinciding with the start or increase of your statin dose, make a note of it. Bringing this observation to your doctor is crucial, as a simple adjustment can clear your mind as if dissipating a fog. It's essential to differentiate between real cognitive decline and a chemical side effect. And while the brain is fighting for healthy fat, your blood may be fighting a dangerous excess, which is our fourth point. We've reached number 4, a silent risk: increased blood sugar levels. Studies show that statins can increase insulin resistance, causing the pancreas to work overtime to keep glucose levels stable. For those who already have pre-diabetes or a family history, this can be the final push towards developing drug-induced type 2 diabetes. It's a cruel irony. We take a medication to prevent heart disease and gain a risk factor, diabetes, that also harms the heart. The key here is rigorous monitoring. Don't rely solely on cholesterol tests. Ask to have your fasting blood glucose and glycated hemoglobin checked regularly. If the numbers start to rise without you having changed your diet, the medication may be to blame. Knowing this allows you and your doctor to act preventively, perhaps adjusting your diet or medication before diabetes becomes fully established. And this metabolic imbalance often begins where we absorb our nutrients, leading to the next uncomfortable sign. The fifth sign involves digestive problems, such as excessive gas, nausea, diarrhea, or alternating constipation. The digestive system is highly sensitive to chemical changes and is often the first to complain. The danger here is not just the discomfort, but the cascade of prescriptions. The patient experiences heartburn or stomach pain because of the statin, and the doctor prescribes omeprazole. Omeprazole, in turn, hinders the absorption of vitamins such as B12, generating further neurological problems. You need to break this cycle. If your stomach or intestines have changed their rhythm after starting treatment, the solution isn't to take more medication to cover the symptom, but to investigate the root cause. Identifying that the origin is the underlying medication prevents you from becoming a walking pharmacy, taking one medication to correct the side effect of another. And sometimes the body tries to expel or signal this toxicity through our greatest defense barrier, which is the next item. Item number 6 is unexplained skin rashes and itching. The skin is a mirror of the liver. When the liver is overloaded trying to metabolize medication, or if there is a mild and persistent allergic reaction, the skin may present with redness, peeling, or an itch that doesn't go away with moisturizers. Many elderly people think it's just dry skin from age, but the location and persistence suggest otherwise. Distinguishing between these is simple. Dry skin improves with hydration. A drug reaction does not. Pay attention if these rashes appear soon after you take the medicine or if they worsen at night. It's your body screaming that the substance is irritating the system. Ignoring this can keep your body in an unnecessary chronic inflammatory state. And speaking of strange sensations, the next sign is often confused with spinal problems, but it has a chemical origin. The 7th sign is numbness or tingling in the hands and feet, clinically known as peripheral neuropathy. You know that prickling sensation or that your leg is numb even without having been in a bad position? Statins can interfere with the myelin sheath, the protective covering around our nerves, impairing the conduction of electrical impulses. The patient feels a loss of sensation in their fingertips, affecting touch and balance. This is often misdiagnosed as poor circulation or lower back problems. If you have normal spinal exams and good circulation, but the tingling persists, statins are a strong suspect. Reporting this immediately is essential, as nerve damage can become permanent if the chemical abuse continues for years. And if you feel tingling during the day, at night, the problem may be an inability to rest, as we will see below. Number 8 refers to sleep disturbances, including stubborn insomnia or extremely vivid nightmares. Some statins are lipophilic, meaning they dissolve in fat and easily cross the blood-brain barrier, entering your brain. There, they can disrupt sleep chemistry, preventing you from achieving deep restorative sleep. Without this rest, blood pressure rises and cardiac risk increases, negating the benefit of the medication. The medical solution is often simple, but requires knowledge. Switching to a hydrophilic statin, which has more difficulty entering the brain, can solve the problem overnight. You don't have to accept sleepless nights as part of aging. Sleep is when your body heals. Protect it. Now, I need you to pay extra attention because the last 2 signs are warnings of imminent danger. The 9th sign is an emergency. Dark or Coca-Cola colored urine. This isn't simple dehydration. It's a classic sign of rhabdomyolysis, a serious condition where muscle fibers break down and release a protein called myoglobin into the bloodstream. This protein is toxic to the kidneys and can cause acute kidney failure within days. If you notice a drastic change in urine color accompanied by severe muscle pain, this is a major warning sign. In this case, the instruction is clear and direct. Seek medical attention immediately. Don't wait for it to pass tomorrow. The poisoning has reached a level where your kidneys are being overwhelmed by the remnants of your own muscles. It's rare, but it happens. And knowing how to identify the color of your urine can literally save your life. And to conclude our list, we have a factor that exacerbates all the previous risks. The 10th and final point concerns dangerous drug interactions. The danger lies not only in the statin itself, but in mixing it with other medications you take for blood pressure, thyroid problems, or even with foods like grapefruit. The liver uses the same exit doors to process various substances. If the exit door is congested, the concentration of the statin in your blood can rise to toxic levels, multiplying the risk of all the side effects we have mentioned so far. Since older adults often practice polypharmacy, the use of multiple medications, this review is mandatory. The practical solution is to take all your medications, or a complete list of them, to your doctor and ask, do any of these interact with my statin? This proactive approach closes the loopholes through which side effects can enter. Understanding this list of 10 signs isn't about being afraid, it's about having tools. And it is precisely with this tool in hand that we move on to the conclusion of what you should do from now on. Now that you have this detailed map in your hands, the game changes completely, and you go from being a passive passenger in your treatment to becoming the active guardian of your health. You no longer need to accept pain, forgetfulness, or extreme fatigue as inevitable companions of your aging. Now you know that they can be cries for help from a biology that needs adjustment. The goal of this video was never to make you fear the medication that protects your heart, but rather to make you respect the complexity of your own body. Statins save lives, it's true, but an informed, vigilant, and metabolically balanced patient lives much better and longer than one who simply swallows a pill and hopes for the best. Today, you have regained the ability to distinguish between the natural wear and tear of time and a chemical warning sign. And this knowledge is the most powerful tool to ensure longevity with autonomy and dignity. Your next step should be firm, responsible, and safe. Never stop your medication on your own, as the rebound effect can put your heart at immediate risk. But use this newfound authority to have a dialogue with your doctor as an equal. Take this list of 10 signs to your next appointment, show what you've learned, and ask openly, "Doctor, could these symptoms I'm experiencing be related to the dosage? Can we measure my coenzyme Q10 levels? What is my actual glucose level?" If this video has opened your eyes, please subscribe to the channel to continue receiving guidance that protects your future, and share this warning with that friend or family member who also takes this medication every day. You may be saving their quality of life. And before you go, tell me in the comments, which of these 10 signs will you start monitoring more closely from today? Finally, it is crucial to emphasize that this content is strictly educational and informative in nature, and does not, under any circumstances, replace professional medical advice, diagnosis, or treatment. Each organism reacts uniquely and individually to pharmacological interventions, and any changes to your medication routine, diet, or supplementation should be supervised by the healthcare professional who monitors your medical history. Our mission here is to provide the light of knowledge so that you can make the best decisions, but the final clinical decision is always the prerogative of your doctor. Take care of yourself, monitor your vital signs, and continue striving for optimal health, because aging does not mean becoming ill. Warm regards, and see you in our next video.